Everyone, I'm Kate Berkner here today with Dr. Tom Phelan, author and creator of 123 Magic, as well as the Manager Mom Epidemic. Dr. Phelan, welcome. Today, we're talking about mom's mental health and kids' behavior. Research often looks at the effects of maternal depression on kind of kids' behavior, but today we're going to be talking about the reverse. How does kids acting up and non-compliance affect the mood of their parents, especially of mothers? So, Dr. Phelan, first question, it's the big one. Is there a connection between depression in moms and kids misbehaving at home?
Yeah, there is, and you have to look at this both ways. So the research usually focuses on if you have a depressed mother, and a lot of moms are depressed after the child and after the child comes home.
Mm-hmm.
Will that affect the kid's behavior? And the answer is yes, it does. The effects aren't huge, but there are some effects on the children. But my problem with that is, what about the reverse? What about kids' misbehavior affecting the mothers and so on? And I think that's been kind of neglected. So that's sort of what we're talking about here. I think what you're going to see, or what we're seeing, is really a two-way street. Is where moms being depressed, for example, can affect the kids' behavior, but then the kids' behavior, whether or not mom's depressed, can also affect her and bring her down in many ways over a period of months.
Yeah, absolutely. And I think I would guess that that's something that a lot of moms are experiencing now, maybe more intensely than before, because of their kids being home more and not being able to go on play dates and maybe go to normal childcare, and just the added stress of everything that's happening with COVID in our country right now probably makes the whole situation a lot harder.
I think so. I think what you get with a lot of moms is a bad case of mixed feelings. I love you very much and I like you part of the time, but I'm really tired of you being around. I don't want to say that. I feel guilty about it. But there's a lot of moms, dads, and family members in general who are overdosing on family with the COVID.
Yeah, absolutely. And it's very guilt-inducing to kind of admit that, but I think that it's probably healthy for us to get honest and to get vulnerable. I may not necessarily say that to my 4-year-old or my 5-year-old, but I can certainly say it to my spouse, right? And say, look, like, I love you, but man, this is a lot. How do we figure this out?
That's exactly right. Say it to your spouse and say it to yourself. This is it's okay. It's not fun, but it's okay.
Yeah. Okay, so one of the things that I was hoping you could talk about, can you tell us what the difference is between dysthymia and major depression?
Yeah, these are the two. When we talk about depression, we're often talking about major depression, which is like you get blasted for maybe a shorter period of time with depressive symptoms, where some people that they can hardly move, they can hardly get out of bed. They have some have trouble sleeping, some sleep too much. They don't enjoy life as much as they used to. Their self-esteem plummets. They're just not having fun anymore. So for major depression, you get whacked with that over a shorter period of time. With what they call dysthymia, or persistent depression, you have those feelings to a lesser extent, not quite so much hopelessness, for example, or depression, but it lasts for a longer period of time. It can last for years. And my point is that I think with both the major depression and the dysthymia, which can happen in the same person, we know that women experience that twice as much as men. And this is adult women we're talking about. A lot of them are going to be moms. So my feeling is, guess what? Don't you think being a mother has something to do with this? And I think it does.
Hmm. So you refer to a perfect storm, right? When it comes to kind of kids misbehavior, family dynamics, and moms feeling bad, whether it is the dysthymia or the major depression. Can you tell us what that perfect storm is?
Yeah, the perfect storm, it starts with the children's misbehavior and mom having difficulty managing that. Add to that, in many families where there are two parents or two spouses, the fact that kids often respond better to their dads than to their moms. So now what do we have? We have a situation where mom looks like the family parenting idiot, and dad can just, yell at the kids or say whatever, and he gets a good response. And then the third part of it is that mom often then, the result is she often winds up feeling isolated from both dad or spouse partner and the kids. So now she's not managing the kids, dad, and some of the dads, I mean, this is a problem. We want the dads to support the mom, but some of the dads will criticize the mom in front of the kids, and then mom feels more and more isolated, often more and more depressed, and so on. And there you've got it. It's a perfectly horrible picture for her.
Yeah, that's got to make her feel really lonely, right?
Yeah, lonely in your own home,
Yeah.
lonely, ineffective, and like I said, self-esteem is kaput, and you're experiencing this in your own house with your own family.
Yeah, and I feel like, when you say self-esteem is kaput, I feel like that relates to what we talked about last week regarding mommy ID and the things that kind of the 10 things that a lot of us moms believe we have to do or have to be in order to be good moms, and not being able to get kids to behave, and having your partner kind of criticizing you for that, that just contributes to the problem in such a big way.
It's right. It's kind of like the myth of Sisyphus, if you know that the guy was pushing the rock up the hill and then it rolled back down every time. It's that emotional burden that many writers talk about. I've got all these huge jobs to do, and I know for a fact that I can't do them properly, and that's just a rotten feeling.
Yeah, absolutely. And just has to feel kind of hopeless, right? Like, especially now, but anytime, feeling like I'm supposed to be doing this thing, I feel like I can never do it right. And that sort of feeds on that feeling of either sort of a low level or a very high level depression. uh, is there any reasonable way for moms to fix this if they've gotten into this cycle?
There certainly is, and there are three very good strategies. The first one is what you might consider psychotherapy, or what we now call cognitive behavioral therapy, where you work with a person, work with a mom, for example, on a self-esteem issue. And let's take a look at, say your conviction that you are not doing a good job. Are you feeding the kids? Are you taking care of them? Are you working outside the home? Let's look at the things that you are doing. And you try and teach a person how to look at their activities and their behavior reasonably, and learn how to give themselves reasonable credit. Not ridiculous credit, but reasonable credit for what they are and what they're doing, and so on. And it works. It takes a while to train people to get a different frame of mind, but it can help begin to lift them out of that depression.
Got it. And if a mom was wanting to go that route, is there something she should look for in a therapist's title or credentials or practice that would indicate what type of therapist she should see?
Yes, you'll sometimes you can see it on their website. And in fact, a lot of therapists will describe what they do, and you want to do cognitive behavioral therapy. The other thing is physician or psychiatrist versus um, psychologist, psychiatric social worker, counselor, or whatever. A lot of times the psychiatrists are good at prescribing the medication, but they don't have the time to do the psychotherapy part of it. So you may want to see a psychiatrist for medication, which is the second thing that can be helpful, but the psychiatrists generally aren't going to do the psychotherapy. So you see a psychiatrist, you can get the medication. You still need somebody to talk to about the cognitive behavioral therapy part of it.
Got it. So we've got cognitive behavioral therapy, possibility of medication,
Mhm.
and those two things maybe being used together if you're going to go the medication route.
Yeah, you can do the medication is good sometimes if a person feels like it's just too much of a bootstraps operation. I can't lift myself by the bootstraps. I just feel like I don't have the energy. A lot of times the medication can help with that. And many times what they call the SSRIs, the selective serotonin reuptake inhibitors, will often have an anti-anxiety effect. So when it comes for me to deal with my husband, who makes me nervous, or my kids who make me nervous,
Yeah.
I'm not as nervous, and I can be a little more assertive, and so on. So the meds, we know the meds help and they work. They don't always work right away. Sometimes it can take several weeks for them to kick in, but they can often be a big help.
Got it. So we've got cognitive behavioral therapy, we've got medication. For the mom that maybe isn't ready to start a medication or wants something that she can start today, what is that third solution, that third possible
Well, the
solution?
third solution, yeah, and in many moms, you don't need to do the medications if you do the cognitive behavioral stuff. And the third solution, which is a good parenting program, a good, assertive, gentle, parents in charge parenting program is often what you can do. I have seen moms over the years whose depressions remit, or mean go away, when they have used 1, 2, 3 magic successfully. Now, it doesn't happen every day. I wish it did, but it has happened. And there are other parenting programs too that people can use. But when mom changes, instead of this defensive attitude toward the kids, oh my God, they won't go to bed, or oh my God, now they're tantruming again, they won't do their homework, what am I going to do about it? Imagine the mom says, well, here's what I'm going to do about it. This is what I'm going to try. This doesn't work, I'm going to do this. And I'm going to try this. I'm somebody in my own home. I have a voice. I can control this place. And once it's fun to watch the moms get back in control and to shape up the dads a little bit too, because it can be done. But a good parenting program is the third step.
Yeah, absolutely. I can see where that would sort of take you from a feeling of hopelessness and chaos to a feeling of control and having a plan. And at that point, it's not about whether I am a good mom because my kids listen to me or don't. It's whether I'm implementing a plan, or if it's not working, I can look at it and go, okay, not I'm such a bad mom, my kids don't listen to me, but okay, where did that deviate from the plan? Where did that deviate from the advice, and how can I do it better next time? It just gives you a place to go that's not like tied to your core identity as a person and as a parent.
Yeah, that's right. And so, people often say, well, kids don't come with a training manual. And so, why should I expect myself to automatically be a good parent and so on? But once you start doing it, you try it out and you get that sort of that confidence and that experimental frame of mind, like you were talking about. If this doesn't work, I'm going to do this, but I'm going to run this house. And running the house also means not telling everybody what to do all the time. It also means teaching your kids and your husband to be more independent, uh, where you have to do less and they do more. And that's a wonderful feeling too.
Yeah, absolutely. Terrific. Well, thank you so much, Dr. Phelan. If this is a topic you'd like more information on, Dr. Phelan is going to be teaching a free seminar next week where he's going to cover more in depth that perfect psychological storm that creates depression in moms, the reciprocal relationship between mom's mental health and kids' behavior, how these specific kinds of psychotherapy and counseling can help, and the ways that a good parenting program can help mom sort of escape from this vicious cycle. And also, like we mentioned at the end here, how to effectively alter dad's or a partner's behavior if they're not necessarily on the same page with you right now.
You got it.
Fantastic. Thank you so much, Dr. Phelan. Thank you for tuning in, and we will talk to you soon.